evening to everyone who has joined us today. I'm Supriya, co-founder of Momly. Momly is a safe and judgment-free platform that helps women with their mental, social, and physical well-being at different stages of motherhood. We are a women-only community, and we provide expert consultations, product recommendations, and all of this is personalized to women at different stages. Today, I'm going live with Dr. M. Sowmya. She's an MD physiology. She's an assistant professor in physiology, additionally, a qualified lactation professional as well. Most importantly, a mom of a 3-year-old, and she strives to support new moms like a lot of us here in their journey of parenting. Today, we have a very important topic and a fairly difficult topic. Having gone through this myself as a toddler mother as well, very excited to talk about it, which is potty training. So, thank you so much for joining us today, Dr. Sowmya.
It's my pleasure, actually. Thank you so much for having me.
Awesome. So we'll get started. I think the very first question is on, what is the right age for starting potty training, right? Because
Right.
we get a lot of mixed reviews. Western says at a later stage. Our Indian tradition parents sometimes say start as soon as possible, right?
Right.
So what is the right age? Would love to learn your insights.
So, as with any difficulty or situation that you come across in parenting, right? The one answer that I give everybody is follow your child. Okay, so that is the mantra that eventually works out for any problems related to parenting. So, ideally, medically speaking, it would be from around 18 to 30 months of age. So 18 is like 1.5 years to anywhere between 30 months of age, because as we all know, each baby is different. So their milestones are not exactly the same. They are not comparable. But when do we say they are physically ready? That happens around 18 months of age. So we all know there are some basic milestones, like, first the head holding happens, and then the trunk muscles, they start sitting up, they start rolling over. So why do these happen in an order? Because the nerves start developing from the neck onwards below, right? So that's why first the head gets your control, then the baby is able to roll over, and then the baby is able to sit up, and then the baby starts walking. So ideally, when they start walking, that is when the nerves that go to the bladder and the bowel, right, they start working well. So the babies are able to hold in their urine or the stools. That is when their nerves are ready, that is when they're physically ready. And it takes a little bit more time for them to be mentally ready also. So that is why the range. So ideally, it is 18 to 30 months when we start talking about or start implementing whatever we need to do regarding potty training.
Got it. Awesome. Great to understand that it actually starts from top down, right there.
Right.
And I think
So
that's
it's
well put.
worth
So,
waiting. Yeah.
correct. Makes sense. So
Right.
I think another question we generally have is, should we have a special potty chair that you get a lot in the market, or do you directly start on the regular toilet with, say a smaller seat, etc. Right? What is
Right.
recommended, and are there any pros and cons of both?
Right. Again, a very, very commonly faced dilemma, because a lot of things are available in the market. So my suggestion is, these are tiny human beings. Okay, so
Hmm.
they need something that supports their body. So, if not a potty seat, at least go for a size reducer on your regular potty, because
Hmm.
obviously they will not fit in the potty or the regular toilets that are meant for adults. They're still tiny. So, ideally, I would suggest go for a potty seat, then transition them from that to a the ring reducer or the size reducer on our normal potty, normal the toilets that we use. And then finally, when they are older enough, transition them to fully using the normal toilets. But again, I would say, do not go for anything very fancy that would distract them from what actually the potty seat is meant for. Don't go for fancy ride on come potty, or play something on the potty. So don't go for all those things which may actually not serve the purpose, because we need to make them understand that potty is for passing urine and stools, not for
Hmm.
playing, not for other activities. So go for something very basic, very simple, that is comfortable for them to sit on. That does not, ideally, the Indian system of sitting is the best for you know,
Correct.
um, the position and everything is best. So go for something where their feet are not dangling, right? Their feet should be firm on the floor, and their position is such that, imagine the way of sitting in Indian toilets. So the knees at around the chest level. So that would be the ideal position. So whatever suits the baby, go for something basic like that. So that is my advice that I usually give.
Got it. I think that makes a lot of sense. I mean, even with my toddler, I had
Right.
that where he preferred the Indian style for quite some time, right,
Right.
before he got used to the Western style of toilets, etc. But in the discussion of, like, how can a parent start that conversation? How do they know, say, a child is ready,
Right.
for potty training? How do they understand cues, especially when the child is not able to tell?
Right.
What would be some of the things that parents can do to start this process?
So, first and foremost, as I said, they have to be physiologically ready. The nerve development wise, they should be ready. So, ideally, when they start walking, that equals to the time when their bladder and bowel start becoming ready. So, next thing we have to look for is their psychological readiness. So, as I said, 18 months is the average age. So, the closer we are the closer we are to 18 months, the faster it is to train them. So, if we start training them at 8 months onwards, it's going to take a very long time. You start training them at around 16, 17, or 15, 16 months, it's going to take a very short time to train them. So, that is the logic here. So, as close to 18 as possible, that is one thing. And some parents follow what is known as elimination communication. That is not exactly potty training. Baby is not yet ready, but as parents, when or as caregivers, when you keep observing the baby, you have at a point of time you come to know or identify certain actions or mannerisms that are going to tell you that your baby is going to poo or pee, right? So a wrinkling of the face, or a squiggle or something, as you every day take care of your baby, you will come to know certain cues. So that is when you just take them to the toilet and make them pass urine there. But that is not actually, it does not come under potty training. So potty training, this is what we call as elimination communication, right? You identify some cues and just take them to the the potty and make them pass the urine. But potty training is when you find signs that the baby actually wants to use the potty. Baby is not comfortable being wet, right? And he or she has uh, some kind of communication. They may not be able to talk yet, but they may point to their genital areas, they may squiggle, they may squirm. And some babies have the habit of going to a particular place when they want to do potty, right? They have a favorite spot. So,
Yeah,
and they are not comfortable in their wet underwear. So
correct.
all these are signs that they are mentally or psychologically ready. They are aware that they are passing urine or
Hmm.
motion. So till a certain age, babies are not even aware. Like they just do potty. They are very happy with the the fully loaded diaper.
Yeah,
So after one stage, they are aware and they are conscious and they are not comfortable with it. They try to somehow communicate it to us. So that is when they are psychologically ready to start potty training.
got it. And should you do some rewards? Because we have heard sometimes parents telling about, like, sometimes I give a star or I give something for the child to mention that either potty is coming or susu is coming, right?
Right.
So any do you recommend rewards, or generally not?
Again, it's a very fine line, between rewarding and appreciating the baby for their good work, right? So I wouldn't say go for rewards, but go for do not forget to or fail to appreciate a good word, a pat on the back, a sticker, or a chart. That goes a long way. But do not go for treats or sweets or a toy or a gift. You know the boundary, the fine line of separation, where they actually do it for the reward and not for the purpose of you know uh, passing urine or stools. So that is where a fine line has to be maintained, like not to fuss too much over this, right? And where the line is. So that is very, very important. So
We have a guest
Yeah,
who has
I would
come to
say,
say hi.
yeah,
Sorry
hello.
about that. No,
Uh,
okay.
that's that's the
Yeah.
story of every home,
Yeah.
actually. Yeah, they have to be there.
Correct. So, I think, as you mentioned, right, it's quite important to, I think, appreciation and reward.
Right,
I think that's a fair differentiation that has to be made, right? So,
definitely, yes.
what about handling accidents, right? They do happen quite often. How can we handle it, and what should parents' response be in such a situation?
Yeah, that's again a very delicate area to handle, because, as we said, this exactly the same way, like how we differentiate between a reward and an appreciation. Do not make a lot of fuss when accidents happen. Do not make a big deal out of it, but still let them know that no, it's not okay. We have to use the potty is meant for using, there's a particular place for you to do this. It's not okay, but not a big deal. It's not a crime, it's not a no, don't make a big fuss out of it, but let them understand that there is a designated place for your potty or wee or whatever. Importantly, use a consistent word for it. If you're going to say susu or we or chuchu, whatever, make sure that all the caretakers and whoever is along with the baby use the same word, because they so that they don't get confused. So make them understand that accidents are okay to happen. As I said, don't make a big deal out of it, but make them understand that it is possible to avoid it in the future.
Correct. Makes sense. I think handling how you approach that is
Right.
also important, right?
Very true.
I'll
Very
just
true.
take, sorry, one gap and question here, right, from Mona, who asked about, does elimination communication actually work, right? So, any thoughts or feedback for her?
So, yeah, as I said, elimination communication is not actually potty training, because the baby doesn't actually understand what we are doing. They're not mentally ready to absorb it. It is just for the, if you have enough time and if you feel like you don't want to use diapers and you want to,
Hmm.
directly make the baby pee in the toilet or the potty, whatever. So at that time, you can follow it. There's no harm in it, but that doesn't actually get into the head of the baby doesn't actually understand what we are doing.
Hmm.
So they start realizing it only after around 18 months of age. They are psychologically ready only after at around 1.5 to 2 years of age.
Got it. She also has a follow-up question, right?
Yeah.
She says, my baby actually gives signs for poop. Is it okay to take her to the potty seat after her signs?
So first of all, we need to know what is the age of the baby, because,
Correct.
as I said, very young babies, when they cannot sit, you cannot force them to sit. Like they
Of
will sit
course,
when they
yeah.
want to.
Correct.
So if a baby is able to sit, ideally, I would say no to making them sit on the potty seat before they are ready to sit and get up by themselves. So once they are done, they should be able to just get up from the potty seat. So that is the stage when you start, making them actually sit on the potty. So I would advise you to wait till then, because starting it too early again, as I said, is going to sometimes going to backfire on us. May take even more time. It may cause even more delay in potty training. So closer to 18 months is what I would
Good.
suggest.
I yeah, as I think you also answered the question last one, which has come again on like when to start, right? So around 18 months is a good time for that.
18 to
Um,
30 months. So don't worry
correct.
if it's not happening at 18, not happening at
Okay.
2, even 2.5 years is fine. Absolutely fine. Nothing to worry about it.
Okay. And the other thing which we also generally sometimes it stops, right? So in my example, also just maybe taking it as my kid had started, especially with Susu, and he was telling and things like that, and then we traveled.
Right.
Right, so then that consistency kind of changed. We also went back to diapers for our convenience, etc., right?
Right.
So sometimes that happens, right? Sometimes children regress back again, he stopped telling and things like that, right? So what can be done in that situation? How can we as parents also support the journey? And is it very stringent that if we have made a timetable of sorts, should we follow it, or any thoughts? Yeah.
So again, regression is very, very common until 5, even 6 years of age. Again, as I said, don't make a big fuss out of it, because and one more thing I forgot to mention during the starting of potty is consistency. So we don't start potty training when you know you're going to have a travel, or when you know you're going to have a, a change in place, or when you know something is going to, like, for example, you're going to start work and the baby is going to be with another caregiver. So when there is some major change happening in the baby's life, we do not start potty training at that time. We start it only when there is going to be a consistency. So that being said, we are being consistent for a long time, and then suddenly, as you said, you have some change, like, baby going to school, or maybe traveling or something like that. So regression is very, very common, and I would say 7 out of 10 children go through regression when some major change happens. Even an illness, a viral fever, a diarrhea, so all that will definitely, have a setback on whatever we have very with lot of difficulty we have achieved all this, and all that will be gone poof in just, one sickness or whatever. But that's okay, because mentally they have learned it. They just need some time to go back to it. It's not that we are going to train them from the beginning. So
Correct.
mentally they are already prepared for it. They have learned it, and somewhere there it is there in their brain. They have not forgotten it. It's just a setback. So as long as you don't make a big deal out of it, just okay, let him be in diapers for a few days. Not no big
Hmm.
deal. Let him know that he has a choice. You want to use the potty, go use the
Correct.
potty. Or you don't feel like it, okay, be in diapers. You want to wear new underwear, okay, your wish. Like, make him feel in control, him or her. Make them feel in control. Let them decide what they want. Eventually, they'll get back on track. The
Got
key
it.
is not making a big fuss of it, and allowing them to have some choices. You want to use
Correct.
this toilet or that toilet, you want to wash your hands by yourself, you want to put on
Hmm.
your pants by yourself. All these motivates the kid. So
Correct. So I think on similar lines, there's a question, right? Is it okay to use diapers when you're going outside, even when you have already started to train, right? So this is like a mix and match, right? Sometimes you go out, you put again back to diapers, versus sometimes when you're, at home, you're more convenient with the, putting.
right,
And also the other question of public restrooms, right? Sometimes we are
correct.
not very comfortable with the cleanliness, etc., right? So also, putting that question forward, what are your thoughts there?
Again, I would say okay to using diaper, but talk to the child. Talk to them that, this is going to be a temporary thing. We are going outside. You're going to be on diapers, but when at home, no, we are not going to use diapers, and you have your own potty, you have your own room, so you can. So because at this age they're capable of grasping certain things. So a
Hmm.
lot of talking helps. So tell them, like, we are going outside, you don't have good toilets there, I'm going to use diaper. But you can't continue that when we come home. They are capable of grasping it, because they're almost 2.5 years old. So yeah, so as I said, don't do this while starting, or don't start your body training
When
while you're going to
going
travel,
out.
or while you're going to once, because toddlers, no, at this age they thrive on consistency. A small
Hmm.
change
Hmm.
will make them
Awesome.
cranky. So
Yeah.
yeah, so be consistent about it. And once potty training is achieved, then going back to diapers and coming back once again to, diaper free time is going to be easy, because that's already there in their mind. They're
Hmm.
not going to relearn it. They're just going to remember it again. So yeah, talk to them,
Correct.
keep them updated, keep them prepared. That is what works.
Correct. And I think, probably one last question on a lot, I think, of us, we find it easy to train the kids in the daytime. The
Right.
night is the tough part, right? And they do sometimes continue to urinate, etc., in the night, right? So, um, you know, when to start that? Also, should it also be started at the same time as day, or, does it come a little later? How to kind of address that issue?
Yeah, so yeah, as I said, basically, by around 1 year of age, if you see, you have dry diapers at night. When they're sleeping, they don't pass
Hmm.
urine
Hmm. Hmm.
mostly. So by like when they get up, immediately they will pass urine. So that kind of happens around 1.5 years of age. So that is when we start, getting an idea that they are ready for potty training. So by around 3 years of age, most children will stop bedwetting. by around 3 years of age. Till then, it is 3 to 4 years, I would say. Till then, it is quite normal and there is nothing to be worried about. Again, when you find that they're fully, I would suggest go for daytime training first. So when they're fully trained in the daytime, then again, for the night time, a lot of talking to them and preparing them helps. So you have a good routine in the night. Make them go to the toilet just before going to bed. Have a good routine, and then you cannot expect them to wake up in between and let you know that they want to pass urine till they are around 4.5, 5 years of age. So initially there are going to be accidents, so be prepared for that. But instead of using a diaper, you can use maybe wet sheets or something, so that they have that awareness of being wet. So when we use the diapers, they are not even realizing that they are wet, so they just continue sleeping. So initially for a few days you're going to lose sleep and they're going to sense the wetness, they're going to get up, but that's how they get used to it. So again, that is a process which takes a few weeks to achieve again.
Superb. I think I will just probably take a pause here. If anyone has any questions, I think there's one here. Should we also set up a routine like making them sit in the potty at a specific time? What are your thoughts on that?
Yes, that does work. But more importantly, it is more important for them to have some word or symbol or sign to let them know when they actually want to do it. So the communication, regular, yeah, making them sit at regular interval works. That is, it makes sense for them because they know that that is the place to go potty, nowhere else. So that way it helps. But more than that, they should learn to, or they should be made to learn to communicate. So have some keyword for that. Consistently use the same word for potty and poop also. So making them communicate is far more advantageous than you being you setting up a routine, because that is how they will learn how to, even when they go to school, when they want to let somebody know that they want to use the toilet. It is better to teach them how to communicate when they actually want to go. So that works in the longer run. That is a better plan.
Better plan then. Got it. So I think while we have some questions coming in,
Right.
just a quick rapid fire. Would you
Sure.
say this is a myth or a fact, right? Can diapering delay potty training? What are your thoughts? Is it a myth or a
Definitely
fact?
not. Definitely not. As long as you're not abusing it, definitely not. So you should know when to use it, when not to. So
When not?
diapering is essential. So you cannot do away with diapering, and that does not affect, because that is, potty training is all about being physically and mentally ready, as I stressed upon. So it has nothing to do with diapering.
Got it. Yes or no, maybe the coming back, how helpful or rewards or appreciation during potty training?
Yeah, as I already said, yes, appreciation is good. Don't go overboard with rewards. That's what.
Awesome. Superb. If there are any other questions in the audience, please feel free to type it in. Or you can also reach out to us or Soumya directly as well. Uh, but with this, I think Soumya, I would, thank you so much for joining us. For I think anyone who's joining now and has missed it, we will also host this on our Instagram, so you will have access to this, and any questions that you have, you can either comment or ask Soumya herself. But once again, Soumya, thank you so much for joining us. I think it was a much needed session, and also very insightful to understand the whole concept of potty training and how we can manage that as parents.
Yeah, so it was my pleasure, and I hope I did some justice to your queries, and hope it was a bit useful to all the new parents. So thank you so much for having me over.
Extremely helpful. Thank you so much for joining us, Soumya. Have a nice evening.
Thank
Take care.
you.
Bye. Bye.
Bye bye.